Have you ever been watching television and seen a commercial or advertisement, and at the end of the ad, you asked yourself in bewilderment, so what do they want me to do? It doesn't happen all that often, truthfully, because marketers and the corporations that they represent have a laser focus. They have their eyes set on their goals and their objectives, and they're going to clearly communicate what they want you to do, what the purpose is. Do we have that same laser focus in our classrooms? If not, we need to improve. Welcome to Health Ed with Cougar, and today we're going to talk about the characteristics of effective health education. Number one, clear goals and behavioral outcomes. I would like to introduce you to a concept that's presented in a tool that's provided by the Centers for Disease Control and Prevention. It's called the HECAT. It stands for the Health Education Curriculum Analysis Tool. And it was really designed to help education leaders at the state or the district or the local education agency make a decision as to which curriculum to choose. And when I say curriculum, I'm largely talking about curricular packages. And yet I have found that for myself and for my young teachers that I'm working with at the university, that we can use the HECAT in a myriad of ways. And one of those is to take from the HECAT, and there's a module for each content area or unit that you would teach in your classroom. And at the very beginning of those modules, they will list what are called HBOs, Healthy Behavior Outcomes. And it's amazing. It helps us accomplish our number one task, which is to really have a clear objective and a laser focus on behavior outcomes. I want to give you two ways that you can use an HBO in your teaching every single day in your classroom. The first is as you begin your lesson planning, right at the very top of your lesson plan, the HBO. For example, let's say you're right in the middle of a substance abuse prevention unit. One of the HBOs for that particular unit says avoid the use of illegal drugs. That's the behavioral outcome that we want students to achieve, is to avoid the use of illegal drugs. So write that right at the top of your lesson plan, and then continue on your merry way with learning objectives and materials needed and time allotted and activities. And when you get to the end of your lesson planning, ask yourself, does everything on my lesson plan help students to achieve that HBO? Does it help them to avoid the use of illegal drugs? And if not, go back and start cutting, start pruning, and make sure that everything, every activity, every story, every skill building exercise is helping them accomplish that behavioral outcome. The second way that you can do this is as you begin your class period, so students have entered, you've said hello, lots of high fives, how's it going today? They want to know what we're doing today. As soon as that bell rings, on the whiteboard, you should have written the HBO for the day. And just write it just as CDC has prepared it. Avoid the use of illegal drugs. Write that right on the whiteboard. And then say, class, it's so good to see you. I'm stoked about today's lesson. Oh my heavens. Everything we're going to do today, and you're going to love it, by the way, because I've got lots of good stuff in there, but everything we're going to do today is to help you accomplish this behavioral outcome, to avoid the use of illegal drugs. And then at the end of the class period, with a couple minutes to go, pull them back together and say, hey class, here's what we did today. And you might notice that everything you learned and all the skills you practiced were designed to help you accomplish this behavioral outcome. That helps us become more effective. Again, the number one characteristic of effective health education, have a clear goal and behavioral outcome. Can you imagine if you were to get out on an airplane and if you could see what's going on up in the cockpit? Can you imagine a pilot to a co-pilot saying, so I'm not really sure where we're going today, but let's just take off, and if we don't like what's happening after the first hour, we'll switch things up. It's absurd. And yet we have many teachers all across different schools and school districts and states and countries doing exactly that. Can you imagine hopping on an airplane and taking off, and an hour later being dropped off at that same airport, right back to the original tarmac. And yet there are countless school students every day who have that experience when they enter into a classroom. I interview them all the time. After observing a student teacher, I'll pop out into the hallway and I'll say, hey, real quick, can I ask you, what do you know now that you didn't know before the class started today? And nothing. Oh, well, what can you do now that you couldn't do before because you came to class today? Nothing. Sometimes I even ask them, what was the topic of the lesson? I don't know, man. Can I go to my next class? Yeah, go ahead. Sorry about that. Oftentimes I will then, as I sit down and consult with a teacher, I'll say, hey, hold on to the lesson plan just for a second if you don't mind. I totally want to get there. But before we get there, what did you want students to be able to do after participating in your lesson today? And I can't tell you how many times I've had a bewildered look on, what do you mean? Well, no, like what were they going to be able to do because they came to class today? Well, I don't know. What was your goal? I don't know. I don't know. Yeah, I don't know either, actually. And I sat in the back and I took like 4 pages of notes. I actually don't know what you wanted the students to know or be able to do. That's lousy education. And we can't have that anymore. It's actually indefensible. And so when your state legislature decides if they want to cut school health, well, if that's what's been happening, then maybe they should cut it. We have to be way better than we've been. We have to have absolute clear goals and behavioral outcomes. Those objectives, they have to be clear to everyone, beginning with us, but they should extend to our students. If we'll do that, we will absolutely be more effective in the health education classroom. That's number 1. We got 14 to go. I hope you stick around. Thanks so much.